I support Planned Parenthood because I think it is the only comprehensive, accessible, affordable, quality healthcare service for women and their families in the state of Maine. And I think for both in Maine and nationally and internationally, for so often women did not have access to those services. And so I've actually been working on this for a long time and supporting Planned Parenthood for the last 30 years to make sure that women and girls and children and older women have access to not just the services, but in an atmosphere and in an environment that's supportive, that's safe, that is affordable, and that they know can be quality. Access to reproductive services is critical. To make sure that they are here and here forever is a key priority of mine. I 100% will uphold a woman's right to choose, and all the associated ones, you know, the ways that they try and get at it, you know, with the number of weeks of gestation and parental consent. And, you know, I've lived through most of the attempts, although they always come up with new ones, to try and restrict a woman's right to choose. So I will make sure that we push the ball forward when necessary. But if there was anything ever that came across my desk that somehow restricted a woman's right to choose, I would veto it without any hesitation. I believe we have to have universal single-payer health care. I think it is a number one challenge facing Maine, and it's the number one thing that I will work on. In the meantime, I think we have to expand Medicaid, obviously, and fund that, but also make sure that Medicaid covers all services, including reproductive services, transgender hormone therapies, whatever it is that people need. Those are things that I will fight for. We have to look at also private insurance and what that covers and make sure there's not erosion in that. You know, we already have single payer. We have it for everybody over 65 and everyone under a certain income level. It's really the people in the middle are the ones who are paying for our current version of healthcare, which is one that has profit incentives in it. And you know, actually the system is so upside down because the system only works and makes money when we're sick. And so I really want to get it to a healthcare system, not a sick care system. And I think we can move very quickly towards that because I think Maine people are ready for it and Maine people want it. I support Planned Parenthood because I want women to have access to safe, affordable, quality services, and I want it available all over the state because it is a fundamental right for women, and I will always be there to stand with Planned Parenthood.